President Biden set to tour a Pfizer plant in Kalamazoo, Michigan tomorrow. That trip was pushed back a day because of the weather. Michigan is a massive vaccine manufacturing hub, but in spite of that, the greater Detroit area is actually desperate for more doses. NBC News correspondent Shaquille Brewster is joining me now from a COVID testing site in Macomb County, Michigan. It's a site the county is hoping to turn into a vaccination center as soon as possible. So, Shaq, explain for us, if you will, what's going on in Michigan. A Detroit area clinic had to cancel nearly 2,000 appointments for second shots today because of an unexpected and significant supply shortage. How is that happening when so many Pfizer shots are being produced in that state? And what are folks in Michigan hoping to hear from the president when he comes there tomorrow?
Yeah, Allison, you get really confused when you hear that there's that shortage that was unexpected in a state that produces at least that Pfizer vaccine. You know, when I talk to officials here, health providers here, it really boils down to the supply. They say we need more supply and we can do more. We can vaccinate more people. The specific issue to Michigan, they say, is for one, you have more people eligible for now receiving the vaccine. So that pool of people who can now go and get a vaccine has expanded. They say the people who can administer a vaccine, that group of people, those healthcare providers, have now expanded as well. But what has not grown is the actual supply, at least not significantly enough to keep up with the pacing of the other two factors. So you have healthcare providers here saying we need more vaccine. We talked about President Biden's trip to Michigan. He was supposed to come today. Now he'll be coming tomorrow. He's going to that Pfizer facility, and they're trying to ramp up the production as much as they can. But there's really that frustration because people here say, if you give us more vaccine, we can do much more, much quickly. I want you to listen to a conversation I had with the chief operating officer of one of the healthcare providers here. They say they've actually seen a slowdown in the pace of their vaccinations because their allotment has been cut off a little bit. Listen to what she told me about what she would say to President Biden.
The president needs to know that we want to partner. As hospitals and health systems, we're huge supporters of the vaccine to the extent that they can increase the manufacturing and encourage Pfizer, for example, Moderna as well, to do that and to get it to us as fast as possible. We want to help people get vaccinated.
Because you did 114,000 vaccinations so far. You think you can do more?
I think, again, we have the capacity, if we had vaccine, to do about 50,000 a week. So we could be a big number.
And how many are you doing now?
Well, this week I think we will do about 5,000 because that's all we got for supply.
Carolyn told me one positive sign that she's seeing in her health network is that she's seeing people who were in that 1A group who decided not to get the vaccine, who said they'll wait a little bit until they see how things turn out. She said more of those people are now asking to get the vaccine. That's good because you're getting more people vaccinated, but that's bad because you have more people demanding, or that you're increasing the demand on that vaccine when the supply also isn't increasing at that same rate. Allison.
Yeah, it is this crazy catch-22 that we just can't seem to get out of. So, Shaq, tell us more about the specific issues where you are in Macomb County. They want to make that facility behind you a vaccine site, but they can't because of short supply. What's going on?
Yeah, what's behind me is an example of what you have counties now saying they can do once they get more doses. So we just heard from the health network, the doctors and hospitals, what they're dealing with, but also counties are also getting vaccinations and getting doses as well. And they're saying, hey, we can do much more. I spoke to the county executive yesterday. He says they're doing about 5,000 right now. He says he believes they can scale up and do about 50,000. He sent a letter off to President Biden several weeks ago saying, hey, if you give me 50,000 doses, I will make sure we get about 40% of our population vaccinated very quickly. They plan to do that by sites like the one behind me. This is a testing facility. It hasn't been that busy. They say they can easily have some of the employees here testing people go ahead and start administering some of those doses. Listen to my conversation with the county executive here in Macomb County.
There's no question our underperformance is a result of not getting the actual vaccine. So we know our potential is being limited because of the doses that we're getting. Less than 5,000. We can handle 50,000 a week here in Macomb County just through our health department. But to get 5,000 a week really severely limits our ability to get them in the arms of the people that want them here in Macomb County.
He also told me after that chunk there that there are freezers that they bought that they spent thousands of dollars on, and they're empty largely because they just don't have that much vaccine. But they insist as soon as they can get the supply, they will get those shots into people's arms. Allison?
Yeah, Shaq, President Biden better be prepared to answer a lot of questions about where are all the shots. It seems like that's going to be the #1 issue tomorrow. Shaq Brewster, thank you so much.
Thank you.
How far would you travel for a COVID shot? A couple from Alabama driving 1,000 miles for a chance to get vaccinated. MSNBC senior national correspondent Chris Jansing went to Newton, Alabama to find out why.
Hi there. Well, for a lot of Americans, the frustration over trying to get a COVID shot has reached the breaking point, and they're willing to travel if they have to get it. Two main kinds of these so-called vaccine vacationers: people who simply don't have the criteria in their state but might in the neighboring state to get the shot, and others who just can't get through either online or on the phone to get an appointment, which is exactly what happened to the folks who live here. Nate and Sue Mathis, he has underlying conditions and had lost a very close friend. But I asked him, why should somebody have to drive 1,000 miles, 2 500-mile trips to get a vaccine? Here's what he told me.
Well, what our problem over here in Alabama is all the congressmen, all but 2 of them, they was interested in trying to get the presidential election thrown out. That's all they were studying. They weren't worried about us people that needed these vaccine shots, and they need to get the priorities in order.
I talked to the CEO of the hospital in Mississippi where he got the shot. He's getting some pushback, but defends the practice. Listen.
My personal feeling is if you can come here for heart surgery, you ought to be able to come for a vaccination. We got to think about what's the goal. The goal here, countrywide, is to vaccinate and save as many lives as possible.
Part of the problem is nationally, no records are kept about how many people are doing this, and the rules are different from state to state. And in fact, they're changing and have changed in places like Florida, North Carolina, and New Hampshire. Back to you.
Life expectancy in the U.S. fell by a year in the first half of 2020. That is the biggest drop since World War II. Racial minorities suffering the most. Dr. Fauci telling MSNBC host Andrea Mitchell it is all because of COVID.
Right now, COVID-19 is the leading cause of death in the United States, which is just extraordinary. It's sad and it's tragic. And actually, when you look at the decrease in the life expectancy, it's absolutely real, and it's directly related to COVID-19. And the differential among people of color versus white again underscores the health disparities. So all of that is intertwined, unfortunately, with COVID-19.
Joining me now, Dr. Ali Raja, founder of Get Us PPE and associate professor of emergency medicine at Harvard Medical School. Dr. Raja, great to see you. Dr. Fauci saying this drop in life expectancy absolutely because of COVID-19. Does anything about this surprise you? And could it drop even more?
Allison, it really could. The thing is that we've seen such a hit on our Black and brown populations because of COVID-19. And now we see these newest data. You know, the gap between Black and white people in this country was narrowing over the past few years. Now it's actually widened again, and the life expectancy gap is 6 years now. The problem is we're not out of COVID just yet. So I wouldn't be surprised if the next time we see these numbers, the gap's actually widening again, which is really, really not where we want to go.
We've seen states across the country handling COVID very differently. California had strict measures. It still, unfortunately, has the highest number of cases and highest death toll in the U.S. We have all seen how bad things got in parts of that state around the holidays. On the flip side, though, Florida has had much looser restrictions, and it's number 3 in the country for COVID deaths. Former FDA Commissioner Scott Gottlieb talked about this on MSNBC today. Here he is.
Different states have experienced the epidemic at different points in time. Different states have different density. The virus got into different parts of different states. And so in some states, it got into a more rural part of the state. In some states, it got into very dense cities. Right now, we have very good data on where the virus is and where it isn't. So you can target the steps more accurately. You can also use testing and tracing as a tool to try to contain spread.
It just begs the question, do lockdowns make a difference? What is the best way to fight this virus? What's your takeaway here?
I think there's two big takeaways here. The first is that we really don't have a coordinated national strategy. We're doing different things. And while we're all trying different things in 50 different states, we get mixed messages all the time on the news. The second thing is I've talked to my friends who are ER docs down in Florida. And while they haven't been locked down, they do mention that given the aging of the population in Florida, a lot of the older patients they see, even without the lockdown, are doing a lot of voluntary lockdowning. So there's some safe practices in Florida, especially in the older at-risk patients.
Nearly a third of patients with severe COVID cases are diagnosed with PTSD up to 3 months after they recover. That is according to a study that's out today in the Journal of the American Medical Association. Given your ER experience, what advice would you give to patients who have experienced a serious illness or injury, who have gone through serious COVID cases to help them manage this trauma?
Well, Alison, I just got home. I just drove home 10 minutes ago from the ER. And in our 80-bed emergency department, we had almost 40 patients with psychiatric illness. We have seen a huge surge in the number of patients who are coming in with psychiatric disease. And COVID is definitely leading to a lot of that. What I would tell patients is if you are feeling some effects of PTSD, if you're having flashbacks from your hospitalization, if you're feeling sad and depressed about the fact that you have been sick with COVID, make sure you get psychiatric help. And the beautiful thing about COVID, the only really beautiful thing, has been that it's expanded telemedicine. And so now you don't have to wait months and months and months to see a psychiatrist. You can see one much more quickly, just right over your phone.
You're the PPE expert. Let's talk about masks for a minute. Homeland Security just sees millions, they say, of fake N95s. The CDC is not necessarily recommending N95s for the general public, but we know some people want extra protection. They are looking for better masks. Are there ways that you can spot fakes, things that you should avoid, and any other masking tips for our viewers right now?
Well, Alison, anybody who's been to New York and tried to buy a handbag on the street knows that it's really hard to tell fakes from real things. And these N95s are not that different. First of all, I want to say that wearing any kind of multi-layered mask is a good idea. So even if you're wearing a fake N95 that isn't real and official, you're probably doing a lot more good than you would otherwise. But if you really want to get into the nitty-gritty, the only real way to tell a fake N95 from a real N95 is to look for the NIOSH seal of approval. So the NIOSH seal is going to be on the box when you buy it, and there's going to be a number. And you can actually go onto the NIOSH website and look that number up and make sure it matches the kind of mask that you bought. That's the only real way to be able to tell the difference.
You know, Dr. Raja, I'm a pro at spotting a real handbag from a fake handbag and vice versa. I wonder if I could be helpful in this mask. It's a New York thing, I guess. Before you go, I just have to ask, any tips for Texans suffering through the cold with no power right now, smart ways that they could stay warm and as safe as possible, especially in light of COVID?
Well, this question really hits home because I've been on the phone with my parents and my sister in Houston. I grew up in Houston, and so the first time I saw snow was when I moved up to Boston about 2 decades ago. But now I'm an expert. And so what I've been talking to them about is the fact that, they have a generator, but you can't put it in your garage. You can't put it near your house because a lot of people are getting carbon monoxide poisoning. So the first tip out of the two that I'm going to give is, if you do have a generator, if you do want to use it, don't put it near your house. My ER doc friends in Houston have seen dozens of patients with carbon monoxide poisoning. The second thing is, there's no reason to keep going in and out of the house. Stay in your house, keep whatever heat is in there. Close up, use your clothes and other things to insulate around your doors and your windows. You will get heat back, but it's going to take another day or two. And the more you open and close your doors, the less likely you are to actually try to stay warm. So I feel for all of your viewers down in Houston and in Dallas and the rest of Texas, I feel you will get through this, but it's going to be another rough day or two.
Oh, and Dr. Raja, we feel for your family. So sorry to hear that so many folks are dealing with that as well. I hope it's over soon and they're doing okay.
Thank you.
See you soon. The anti-vax movement isn't new, but the pandemic triggered an explosion of misinformation online. Now some liberal groups are joining forces to fight the false claims aimed directly at Hispanic communities. The program, Latino AntiDisinformation Lab, launching this week. Maria Teresa Kumar, founding president of Voto Latino, leading the way, calling this a matter of literally life and death when disinformation is targeting a community to the point that they don't take care of themselves and don't get vaccinated. I'm sure you guessed by now that is not her on the screen. That is NBC News senior political analyst Jonathan Allen, but he wrote that story, so that's why he is with us. John, Maria Teresa Kumar, who's also an MSNBC contributor, launched this campaign after learning her own mother was going to skip out on the COVID vaccine because of a meme she saw. Tell us more about her story. It's just incredible.
Yeah, I'm neither Harvard Medical's Dr. Ali Raja, nor am I Maria Teresa Kumar, but I do bring this story to you from Maria Teresa. Her mother, who runs an elder care facility in Northern California, had an opportunity to get the vaccine and was going to forego it. And Maria Teresa inquired why, and it turned out her mother had been getting peer-to-peer meme sharing that said that in Spanish language that said the technology was the term that was used. The technology for the vaccines was unsafe for human beings. And Maria Teresa looked at the stuff and talked to her mother, and eventually her mother got the shot. But it sort of mixed in her mind in terms of something she was already looking at, which was how to combat disinformation in an election season.
Yeah, I mean, John, you raised that, right? For people listening to this thinking, I've heard this somewhere before. This is really similar to what we were seeing during the election. Could you just tell us more about who's behind this, why they're targeting Latinos in particular, sort of what the connections are here?
Well, it's really hard to trace sometimes what Maria Teresa and the folks at Media Matters. So Maria Teresa runs Voto Latino. They're hooking up with Media Matters to try to put together this $22 million project to combat disinformation. What they say is, even though it can be hard to track sometimes, what they're seeing is that these memes are coming from right-wing activists, and their idea is to be able to track them better. Media Matters watches lots of hours of television so that others don't, and tracks radio and advertising. And so they're going to join forces, and they're also bringing in Tom Perez, the former DNC chairman, to try to get up and running first on COVID-19, to try to push back on messages that might prevent Latinos or influence Latinos to not get vaccines, and then ultimately morph that into something that is for the midterm elections to try to combat what they say is a lot of disinformation out there, and specifically at Latinos through Spanish language advertising and media, and even group chats on the internet.
Yeah, I mean, John, $22 million, no small chunk of change, a pretty decent place to start. I mean, for viewers of ours who are thinking, my gosh, like we just got through the 2020 election, I can't even think about the midterms right now. I mean, this is when you have to start thinking about the midterms, right? It's not that far off.
Absolutely. The political class is not just thinking about the midterms, but 2024. We're starting to see potential Republican candidates for president gearing up, in different ways. And so the midterms are just around the corner in this permanent political vortex that we find ourselves in. And I think that's why you're seeing Voto Latino and Media Matters get going on this now.
Yeah, a vortex is a great way to describe it. We just seem trapped in it. We can't escape. We may show his face when we're mentioning other people's names, but there is no mistaking the one and only John Allen. Sir, always wonderful to see you.
Always good to be with you, Allison.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.